Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication that is an antidepressant. It's known as Tranylcypromine with the brand name of Parnate. Before we get started, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So as I mentioned, this medication is classified as an antidepressant. It falls into the class of monoamine oxidase inhibitors, and to be more specific, it's an irreversible monoamine oxidase inhibitor. We see it commonly used in atypical depression, as well as depression that hasn't been resolved after the use of other agents. It can be used in phobias and rarely in bipolar depression. It can be used prophylactically for panic disorders, and it can also be used for obsessive compulsive disorder. It may improve the negative symptoms of schizophrenia, and it can also be used in post-traumatic stress disorder. Lastly, and something that I just learned when I was researching this medication, it does have an antiherpetic effect, and so it can be used in some situations when an individual has herpes. This monoamine oxidase inhibitor non-selectively inhibits the MAO-A and MAO-B enzymes. These enzymes are involved in the oxidative deamination of serotonin, norepinephrine, and dopamine. So this causes a downregulation in the beta adrenoreceptors. Inhibition in this situation is irreversible and lasts about 10 days. Now, before somebody was to start using this medication, there are some precautions and contraindications that must be considered. One is that the medication should not be used in individuals who have cerebrovascular disease, cardiovascular disease, or a history of hypertension. It should not be used alone in patients who have marked psychomotor agitation. It's important to note when changing from one monoamine oxidase inhibitor to another, or to a tricyclic antidepressant, there should be a washout period of 10 days. 10 to 14 days should be given before an incompatible food is given, or before a surgery, or before an ECT. Finally, extreme caution must be followed when using this medication with any other agents that have serotonergic properties. This is because there would be a marked increase in the risk of serotonin syndrome. When somebody starts using this medication, they'll be receiving it in a tablet form. It's available as a 10 milligram tablet. Because of its short half-life, typically it's dosed twice daily, once in the morning and once midday, to avoid overstimulation and potential insomnia. Like most medications used to treat depression, the dose will depend on the patient's response to the medication itself. Recommended starting dose for this medication is 10 milligrams in the morning and 10 milligrams midday. It could take anywhere from 48 hours to 3 weeks to notice a benefit of the medication. If after 3 weeks there's no improvement, the dose can be increased to 30 milligrams a day, which would typically be given as 20 milligrams in the morning and 10 milligrams midday. Most patients do find success and stick with the maintenance dose of 20 milligrams daily, broken up again as 10 and 10, but some patients actually find success with 10 milligrams daily. Now, as with all medication, there are some side effects or adverse reactions that people may occur while they're using it. Some people notice a drowsiness effect when they're taking it, while others can actually notice a stimulant effect, which can cause insomnia, restlessness, and agitation. Many people do have an increase in their sleep onset latency, and they also have reduced sleep efficiency. REM sleep is decreased in these situations. Some patients using this medication with bipolar disorder may experience a hypomanic episode or a manic episode. Chances of this are decreased by about 35% if we add a mood stabilizer to this medication. Some people experience anticholinergic effects such as urinary retention, dry mouth, constipation. Hyponatremia and SIDA have been reported. Some people notice an increase in appetite and weight gain. There can be some sexual side effects with this medication, as well as a decrease in sperm count. There have been rare cases of liver toxicity, as well as people experiencing hair loss. Finally, there have been case reports of thrombocytopenia. That's all we're going to discuss today with Tranylcypromine or Parnate. As always, I'm thankful that you took the time to stop by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or subscribe to the YouTube channel, most importantly. There's also some links down in the description that you can check out as well. All right, take care.